Well, I'm now coming off the clozapine. I couldn't tolerate the side effects.
The primary side effect I experienced was just tiredness, just being very tired all the time.
The muscle aching.
Sort of having blurry thinking all the time.
The following is a public service announcement. Bad medicine.
So pharmacogenomics is really what happens at the intersection between pharmacy, drugs, pharmacology, and genetics. All drugs, or most drugs, are broken down in the body, and the enzymes that break down those drugs in the body really are genetically regulated, just like everything else you have in your body. And we know that based on the genetic variation that you have, it may cause someone to have too much of an enzyme or not enough, or kind of an intermediate sort of phenotype. And for drugs then, that might mean that if you lack that enzyme because of what your DNA sequence is, that you lack the ability to break down a drug in your body. All of the receptors that the drugs work on are also genetically regulated, and for some of those, it might actually make a difference and affect whether someone is going to respond to a medication or not. For a lot of insurance companies to kind of cover it, there needs to be a documented failure of several different medications. So it's kind of often, you failed 3 to 4 medications, you're not really sure what to do. Try this test and see if this will help. The testing that is going on is kind of being done by private companies that physicians contract with, and then the patients do a cheek swab, they get sent to the company, and then the company sends it to the provider. Right now, a lot of the testing that can be done is done through different commercial companies, and the way that they've done it is through creating certain panels. So there might be a panel related to antidepressants, there might be a panel related to antipsychotics, there's one related to attention deficit drugs, stimulants are the primary drugs that are included in those. And so that's kind of the way the companies have done it. We need to figure out a way to screen patients so that instead of only 30% of patients we actually make a change. We're pre-selecting those that we think aren't going to really result in a change, and that we really target those patients that we think that we're actually going to use that information.
I feel like I would, just to have the information. I think that would be interesting to know, and in selecting medications I could take, it could be helpful, but I would want to rely on other information as well.
I want to say yes, because on the easy answer is yes, it would be great to know what medications are right for me, what would work the most efficiently according to my personal genetics. But at the same time, I would have a lot of questions about what kind of other information would be found using my genetic testing, and where this information would be, and if it would be safe for me as a consumer. As good as it sounds, it's a hard call.
It creates a sense of trust in people because you trust your doctor, they're like an authority figure, and then you're getting this information that this drug will work better for you or will work for you, so you're going to trust that medication will work. It kind of absolves the fears that some people have when they're starting to take medication, so I think it kind of takes away the pressure of side effects and things that people are hesitant about.
How would it affect mental health treatment? And I think first and foremost, I think patients might actually take their drugs.
I think that it could end up making things worse because it's kind of like putting people into boxes based on their genes and what medications work best for certain people. Yeah, it kind of seems like a black and white way of looking at something that could have gray area, because then doctors just do this testing and are looking just at genes where there could be other factors involved. I don't know, if it comes down to that it's only the genes that affect it, then it would be great, but I would want to see more research to know that environmental or outside factors don't play a role.
There's concerns about, like we said, the privacy and the potential usage of your genetic information. I think if my insurance covered it, I would be more willing to consider it.
A lot of the pharmacogenetic testing is not necessarily being covered by insurance, which can be a barrier. And so a lot of the testing companies now are realizing that and offering discounts if your insurance won't pay for it. Those groups are slowly catching on that this might actually help save costs. And it's also a test that you get once and it might have impact years down the road.